I'm just going to go ahead and lie down this little exam bed for you. I'm going to go ahead and show you a realistic ear exam. I'm an actual physician. These are some of the materials that we're going to be using. I'm just going to put them out here on the table. But if you are squeamish, since we're going to do an ear cleaning, this might not be the video for you, because I'm going to do an ear cleaning using the equipment that you actually use in a modern, pretty advanced medical center, and it includes video so that you can see into the ear, your ear, and so you'll be able to lie on your side and look at the same time. So if you're squeamish, then maybe just listen. There's going to be some good sounds, obviously, but yeah, I'm a real physician, and we're going to do pretty close to the real thing. So real quick, I'm just going to look in your ears, and then we're going to hop right into the cleaning. Yeah. Well, so nothing I say here can be for official diagnosis or treatment of any illness, even though I am an actual physician. Just because, I want to keep you safe. You and I have not ever had a, true individualized session. But I figure that we can get some good ASMR done, and in a more realistic way. Yeah. So I'm going to go ahead and look in your ears. Do you have any ear pain? Okay. Any bleeding out of your ears? You should not really get a full ear cleaning if you've been bleeding. Okay. Any recent infections? Okay. Any trauma to your ear? Now, when you try to clean your own ears, do you stick things in them? Okay, and you're not supposed to do that, so don't do that. Even like just itching can make them pretty inflamed. Do you have allergies? Okay. Any kind of runny nose, things like that? Okay. Any changes in your hearing? Okay. Can you hear this okay? On this side? Okay. I'm going to do the same thing over on this side. You hear that? Phenomenal. Okay. If I whisper, can you tell me what I said? You are important. Okay. Other side. You absolutely matter. Okay. Perfect. Alright. So yeah, you'll see that like actual ear exams don't take a million years, like in certain things you'll see. It's actually just real quick. Yeah, absolutely. And of course I washed my hands when I came in. You saw that. But I'm just gonna go ahead and kind of, to help visualize the ear canal better, we'll like grab and pinch and pull up. Although I did just touch myself, so now I'm gonna have to hand sanitize. Would you like some? Yeah, absolutely. Here you go. You can have some too. This is scented hand sanitizer, which is kind of neat. Yeah. So one thing I like to do also is feel along the pinna and the auricle, just the whole ear. Kind of feel for, any kind of pain, anything else like that. I actually also do battlefield acupuncture, which is a kind of acupuncture in the ear that I am credentialed for. And we can do that at some point, one video. We'll do a real life battlefield acupuncture like type thing, like what it actually looks like. So for here, I just pull up on the ear and then kind of really look in. And what I'm looking for is there any erythema, edema, any kind of exudates? Any kind of edema really, anything else like that. And this kind of includes like a little magnifying glass so that, you really zoom in, you really see the details. Looking for bulging of the tympanic membrane, that's really important. If you have one ear that's infected, I switch out in between so that you don't move the infection from one place to another. But with an ear that looks as good as yours, it's not a problem. So what I said about erythema, I will say your ear canal, and you'll see this in a second on the camera, your ear canal is a little bit red. You're not bleeding or anything that would make us not able to do any cleaning, but your ear canal is a little bit irritated. It's, you know, again, why we ask about allergies. Did you ever have a history of frequent infections as a kid? I know you station tubes. Okay. So yeah, it happens that like you have right now, it looks kind of red and irritated, but not like that would contraindicate a cleaning. And you do have some gunk, like some of it up against the tympanic membrane and some are on the side, but again, no bulging of your tympanic membrane, nothing like emergent, just we can do a cleaning. All right, well, let's get her done. I'm gonna have you have a seat in this room, and you will see in just a second. So, anything else that I should know? Anything you think I should ask that I haven't asked? Absolutely. All right. You'll see the screen over there is where you'll be able to see yourself, or inside your own ear, basically. Tools are on that table. This thing is, I know it looks like an alien torture device, but it is a light and basically a video camera, so I can look into your ear. Yeah. So yeah, you can just turn your head and get comfortable here. You can face the camera while I get your, obviously when you turn the other way, you're not going to be able to see. But while we're doing this ear, you can totally see and look and kind of watch me do the cleaning. This tube thing is called a speculum. Just getting that situated in your ear. And that brown stuff is called cerumen. And you can see it's already gotten a little gunky on the speculum from your ear as I was just adjusting it, but that's okay, don't worry about that. Give me just a second here, I'm going to get one of my tools. So, when you are like just kind of cleaning, like the way I teach my medics is just to pipette water in and out. And then of course I've done cleaning where I'll use, this is a suction thing. Yeah, so you're gonna feel some suction as I'm trying to like suction the gunk out. It's a small little suction machine. And it should feel and look kind of satisfying, just getting this stuff out. So we want it to all become like white. Your tympanic membrane is that clear, like white looking thing there, and way at the back, and that's your eardrum. That's what you hear out of. Yeah, it's just kind of difficult to get it positioned in this kind of narrow ear canal. So, but yeah, that's what we're doing. Just kind of using some good suction, and you know, it's kind of enjoyable to watch, I think, too. So, usually in a like this is the kind of equipment an ENT clinic has. In my generalist clinic, usually I just have the little curettes, which are the like little spoons that we use to get stuff out. And I'll use like a handheld thing to watch and make sure that I'm not getting close to the tympanic membrane. Can't have any bleeding or anything like that, then you've got to stop or not do it at all. So sometimes you'll have like little liths, little like almost like rocks formed of like just cerumen and like I guess fungus too sometimes. In this case, in your ear here, it's just you've got some gunk around the ear canal there. And I don't know if you can see, like it's a little bit red. Your ear canal is a little redder, kind of irritation, so like, that can be a sign of like some allergies. I know it looks kind of like red and itchy. So I'm trying to be real careful because right next to your eardrum can be real sensitive and painful. Ear cleanings can be super uncomfortable, but this one is pretty comfortable and satisfying just to kind of get that stuff off. It kind of like helps. It's like scratching an itch that you can't reach. So just getting these little pieces off here. Some of that stuff is pretty dry, so just kind of repositioning and everything else like that. Yeah, definitely. Yeah, absolutely. How long has that been going on? Oh, I see. So you can see I'm coming back in here again. Just trying to get that stuff that's right there on the edge. Get it real clean so that you feel like you can, hear and stuff like that. Some people, like Sonia, I can see the tympanic membrane pretty well, but like if it's totally occluded, you really can't. It's real difficult. I also have really, really narrow ear canals myself. Really red ear canals because my ears are always itchy. And it's allergies, most likely. So the white stuff is like dried cerumen and dried skin and stuff. Just kind of getting some of that off. Yeah. Like I said, it should feel pretty good. It should be kind of like scratching an itch, getting the itch out. Yeah, so like at home, what you can do is you can get some carbamide peroxide. Carbamide peroxide is a pretty good thing, like it's a chemical you can put in your ear that kind of is really a catalyst for breaking down tissue, and it can loosen up everything. Yeah, exactly. It makes a nice bubbling sound in your ear if you're into that. It's pretty sweet. Yep. You're pretty tough. Some people can't tolerate this near to the tympanic membrane. But yeah, it feels good, huh? It depends on how much you can tolerate always. It's different people can tolerate different amounts of stuff. So, like I said, like having a narrow ear canal definitely makes it a lot harder. Usually the top part of that ear canal wouldn't, like the top part of the entrance there wouldn't be visible. The speculum would be able to fit all the way in, and you would only be the tympanic membrane we'd be looking at in the ear canal. So. Yep. So yeah, just trying to get some of that stuff. Yeah, in a normal non-ENT doctor's office, you don't get to look. You don't quite get to see this stuff. So, yeah, those are blood vessels. Can you see? Like if you really look close on the actual eardrum, yeah, that's normal. Some people will have, a lot of people, especially who had frequent. Oh, here I'm gonna go ahead and put in some of this. This is like the peroxide stuff I was telling you about. It's bubbling because there's a chemical reaction happening between it and your ears. So, yeah, you might feel kind of warm. You'll see more of it bubbling up. This really helps to loosen some of that stuff up. So it's a lot easier to section. It's a little tickly. It feels a little tickly in your ear. Kind of pleasant. Now this stuff comes away a lot easier. But yeah, as I was saying, some people do have some scarring on the tympanic membrane. It'll be like a white line down the middle of it. That usually means that they have like frequent ear infections as a kiddo. They might have had tubes put in. Everyone has eustachian tubes, but people have like little tubes that go into those to help with drainage for people who have like frequent infections. Yeah. No, I don't know how to do that. That's an ENT thing. You would need to go to your ENT provider for that. To your specialist. I'm getting some of this stuff. A lot of this stuff is a little more loose now, see? You can see some bubbles still there up against your ear canal. your eardrum actually. Alright, give me a second here. There we go. See, like, it looks pretty good now. Sometimes the hardest thing is just getting the camera to focus. So we have pretty much everything all the way down close to the tympanic membrane. Your ear does look kind of itchy. Sometimes you can take, like allergy medications will help with that. And of course you can go talk to the ENT doctor about it. So, but it should feel a lot better now. So yeah, normally they're not so itchy and scaly looking inside. Normally it's kind of smooth. Yeah, and so there's just that last little bit there against the tympanic membrane. We want to be careful and definitely don't want to kind of make you bleed or anything, but in general, you know, it's pretty much done. We just kind of want to be careful. Yeah. Yeah, sure. Yeah, definitely any questions that you have, you can definitely let me know. I'll always tell you if I can't answer it, so. But I'm pretty happy with it. Looks pretty good. Just that last little bit of skin we can try to get here. And that's it. We're done. Looks good, huh? Looks pretty good. It's definitely a lot better than it was before. Alrighty. Well, thank you for, letting me take care of you. Alright, yeah, you can collect your things. Yeah, any final questions? No? Alrighty. Yeah, like I said, you can collect your things and follow up with the audiologist for your hearing test. That's where they do the little beep, beep, beep sounds at you. And I would check in. You can either get a referral for allergy, or we can just try some allergy medications straight up. Yeah, that sounds good. Alright, let me enter that in here for you. Yeah, you can just stop by the pharmacy on your way out. No, these are going to be ones that you take. There are possible eardrops and things like that, but I'd rather you talk to ENT first before doing that. So we can try that. We'll hit up audiology, try a little bit of the oral allergy medication, and then depending on how you're doing, and then, making sure you put some of that nice carbamide oil in every now and then to kind of like soothe, clean out the area. And then, yeah, we'll go ahead and get you some, if that all fails, then you can hit up ENT and we can see if there's another eardrop they can recommend. You don't even have to go to ENT. I can actually just talk to them, do a doc-to-doc consult and see if there's a good eardrop they would recommend. I have your pictures, so that way it's cheaper for you if you don't have to all the way go, and I can call them. And, yeah, we can work it out. Alrighty. Have a wonderful day. Thank you.